just look now at the all India picture. In the last 24 hours, which are the states that have had the highest increase? Well, leading that is Maharashtra, as we just reported. The worry, of course, the new areas. So 5,638, then Tamil Nadu, then Karnataka, then Telangana. So of the top 5, 3 in South India, followed by Delhi, where the highest deaths been in the last 24 hours, again in Maharashtra, in Tamil Nadu, Delhi third, Karnataka, and then Uttar Pradesh. Now, joining me more, I've got a very special panel of guests. I'm joined by Dr. Rakesh Verma. He's Additional Director General of Health Services of the Government of India. I'm also joined by Dr. Radhakrishnan, the Tamil Nadu Health Secretary. Also joining me from Mumbai is Dr. Om Srivastav of Infectious Diseases, a consultant at Jaslok Hospital. And also with me, Dr. R. Abenza, Head of the Critical Care Services of Apollo. Dr. Verma, if I could begin with you, what would you see as the overall pictures given the 5 worst states in India? Where do you think are the areas we need to really focus on now? And where are the areas where you think there has been great success?
See, the efforts of the government and the public in this aspect have been very fruitful. With our population of 130 crores, if you see the numbers, they are still quite large, but quite in manageable range. So we have to confine ourselves more focused in the containment areas, red zones, where the numbers is increasing and duplicating it very fast. So all efforts should be focused on those while not overlooking the other areas. In this, we have to break the chain of virus by basic fundamental principle that we have been following till now. That is social distancing of 2 meters, using a mask whenever possible, whenever we go to the public, cleaning our hands, and using a sanitizer as and when required. But social distancing, medical distancing of 8 feet, 9 feet is the most desirable thing. Use a mask without any hesitation is the thing of which is maximally required. Without the cooperation of the Indian population, no governments, no medical fraternity can win this war, which you and I fully appreciate. It's time to educate our population. Please follow the government guidelines. Please follow the local administration's guideline. Please follow your local doctor, your neighborhood doctor. This war is not for protection of our borders. This is a protection of our own home, our own family, our own mohalla, our city, our district, our state, and our India.
That's an interesting analogy. It's a war that we are waging not at the borders, but a war that we are waging right here. As I said, from a home to home, guard your homes first and then you'll guard the country in a sense.
First, we have to protect ourselves. We have to get ready for this. And I must tell you, a lot of Indian population is cooperating, is supporting this war because they know this war they have to fight. This war is our fight.
Absolutely. I think the warriors also are all the doctors who are here today. And of course, the Tamil Nadu Health Secretary, Dr. J. Radhakrishnan, who, sir, is really in the hot seat. We've seen Tamil Nadu crossed 1 lakh cases, the second state in India to do so. And though Chennai is showing a decline, there is worry in other areas. What is the biggest challenge for you in Tamil Nadu today and how are you battling it?
See, Tamil Nadu, actually the active cases are somewhere around 45,839. The positive aspects are that, Chennai has it has been showing a continuous lesser figure each day. But that, having said that, we cannot just take it as a definitive trend. So this intensive having fever camps and the containment area tightening and also ensuring that the sample collection and Tamil Nadu's recent policy has been to go for very aggressive RT-PCR testing. We are not going even for antigen-based testing. We tested almost 37,000 samples today. Chennai alone is always in the range of 10,500. But like you rightly pointed out, we cannot lose sight of the challenges in Madurai, Ramanathapuram, Vellore, and each area has its own specificity, that, a specific cause. So we are basically looking at ensuring that, if Madurai shows on an average 300 cases, means it should test at least 3,000, if not more, and ensure that the testing is very near the containment areas, allow people to take advantage and also monitor the other similar diseases like, severe acute respiratory infections or influenza-like illnesses. And have a micro plan, look at street-wise strategy. Because earlier in Chennai, the biggest problem was when we are looking at a generalized containment areas, we are still finding that, the cases were not getting effectively controlled because there was some challenges in the perimeter control issues. We have actually looked at, involved NGOs whatever we have been doing in Chennai, the Chief Secretary and the Honorable Chief Minister said, replicate in the areas where we are getting fresh birds. So that would be our focus area.
In fact, that's a question I'd like to ask also to Dr. R. Benzo, who joins us, Head of Critical Care, because really, I think the focus also not so much just only on bringing down cases, but how to bring down deaths. And so far, India is at number 8 in the world. It's still low compared to other countries with similar number of cases. Dr. Benza, how do we actually look at that providing of critical care? Tamil Nadu relatively better off than other states, but for ICUs, for ventilators, for trained doctors, for trained nurses for these ICUs, how do we deal with the issue of critical care to bring down death rates across India?
See, as you know very well, Tamil Nadu has been blessed with a robust healthcare system. Not only in the private sector, our government sector also has a very good healthcare system. So one thing which we have to understand is, as you know, COVID pneumonia affects the spectrum is so huge. Sometimes people are so asymptomatic and some patients land up on the ventilator also. So the spectrum is so vast. So critical care is one area where our prime focus is to somehow save all those patients who are coming into the hospital and who require ICU services. So that is the area where maximum number of mortalities can take place. But that is one area where if we have adequate facilities like good ICU and a good negative pressure room, isolation rooms, ventilators, very good nursing staff, very good intensivists round the clock, we'll be able to bring down the death rate. As you see, our mortality rate in Tamil Nadu is very, very low compared to any other state, any other place in the country.
No,
so
in fact,
these are certain things which, we are also trying to, this is a new disease, but what we have realized is, wherever we are able to provide a certain level of acute care, continuous monitored acute care, we are even able to save those patients probably who might have not done well. We have just pulled them away from the jaws of death.
No, and
so
I think
some minimal things have to be done. Yeah, exactly. Yeah.
No, I think saving from the jaws of death, yes, some minimum things you're saying, and Tamil Nadu's healthcare, of course, is an example of the rest of the country. But the worry, as I said, even though the mortality rate is low compared to the population, it's still amongst the top 5 in the last 24 hours. So the focus on how to bring that down. But I'd like to bring in Dr. Om Srivastava, because Maharashtra is still topping. And I wanted to ask Dr. Srivastava, because Mumbai was really the worst hit when this whole pandemic actually in the first months. Now we're seeing Pune, Thane also rising. Why is it that those lessons perhaps which Mumbai learned by being in that first wave of deaths coming through and the hospitals being overtaken, why aren't these lessons being learnt in the satellite cities as well of Mumbai and Pune and Thane?
Well, that's a very good question. See, one part of the story is about after the lockdown, the population of, daily wages or migrant workers, those people who were requiring for their livelihood to go from one satellite town of Mumbai to mainstream Mumbai, the proper South Mumbai or even up to North Mumbai. And a lot of these people who were coming from those areas were probably mixing with those people who were either infected or were still recovering. And that when you have that large population of people moving from one place to another, the chance of passing the infection becomes very easy. That is probably what is happening. That is probably what has happened, because if you look at the Dharavi model, that is one of the best models in the entire country of how a jam-packed place can be made to, you can contain the outbreak of the virus in a place like Dharavi. If you can do that in Dharavi, you can replicate that model everywhere. But remember all the benefits that we have had of the lockdown, all the 8 and 9 and 10 weeks that we were able to contain the disease and the progress of the disease and minimize the number of deaths. All that is going to be lost if we are not able to follow the very basics of social distancing. If we are simply going to be going back to our ways of life, our old ways of life, then I must say that there is a cause for concern, and that you're probably going to lose all the gains that you've had in these 8 weeks or 10 weeks of lockdown.
No, in fact, I'd like to bring in Dr. Rakesh Verma on that, because that's a very valid point that Dr. Verma, in a country, a subcontinent as large as India, we're seeing that states, there are different waves that are hitting states and cities at different times. So, you're talking about a first wave, then a second wave. One state may peak or one city may peak, but then another city becomes your epicenter. How do you deal with an issue like that, especially on the question of lockdown fatigue, that a lot of people feel that because the lockdown has opened, we can go back to life sometime as like normal. Offices are opening, people are using transport in some cities are locked down, some aren't. Do you think this local model is really working, or do we need perhaps to have some kind of uniform model all over again as cases are rising?
A uniform model is very much essential and being propagated by the government, state government, central government time and again, which start from basic protection of self and protection of our own relatives, our own family from being infected. Basic principle is stay at home as far as possible. Get out only when it's really unavoidable. Do work from home so far as possible. If you are compelled to go, please do not go to a crowded place. Go at a time when the crowd is less. Please use a mask always. You can use one 3-layer mask or you can do 2 masks and you can cover it. If you don't have it, use a thick handkerchief and cover yourself. You must cover yourself. If you're talking to somebody, please don't talk face to face. Look at left, look at right. Don't avoid a face-to-face talk because the droplet from the mouth can come or go from you, or you can receive them from an infected person. And other person may be infected and may not be having symptoms, because asymptomatic patients can also infect other normal uninfected persons. Then maintain social distancing. What you can talk on telephone, don't go in person. What you can talk, you have to meet somebody, meet on video. What is the requirement of meeting in person?
Right.
So far is
no, but I agree with you, Dr. Verma, on these. But when India, for a sense, you're going to have elections soon in states. You're going to have by-elections. Your religious places are now open. Shops and malls are open.
That is a very difficult question for a doctor to answer. I think that answer lies somewhere else.
So tell me, sir, as a doctor,
the elections are concerned.
Yes, go ahead.
We will be requesting at that time also, please maintain the social distancing. Please maintain this medical distancing. If you go to a party, if you're meeting a gathering of religious congregation or married congregation, do not hesitate in using 1 or 2 masks. Do not feel that this is a sign of being weak or being sign of being sickness. It is a sign of your own protection. In winters, we wear sweaters and coats. In summers, we use air conditioning. That is not sign of weakness. That is sign of being preparedness.
That's a very interesting point. You're saying wear 2 or 3 masks even when you go to a crowded place. That's a great idea, actually.
See, reason is, it is a method of being prepared. It's not method of being scared.
Right.
That mentality has to go.
Just to ask you, sir.
A lot of people come to me, hum to bagair mask kaam chalate, I can do without a mask. I tell them, this is a way of being prepared.
Yes.
This is a way of not being showing your weakness. So that kind of situation one has to adopt. And if one does that, the chain will be broken, the virus chain will be broken, and the country will be protected.
Just to ask you, sir, as a doctor, on the medical grounds, what do you think when we talk about that India is going to hit a peak? When are we going to see the flattening of the curve? What do you estimate this to be? And what have you noticed on how the virus is behaving in India as compared to the rest of the world?
I personally feel the peak is all over, and the situation is quite under control, subject to all of us following the conditions imposed, requested by the medical administration, state administration. If we can do that, we have won the battle to a very large extent, but there is some segment is still to be won, and we all must aspire, do hard work to win over this war once for all. But we have to continue to live with this corona for quite some time. We must believe that, we must trust that, and modify our lifestyles according to these precautions. Remember that corona is not going to go away that fast as we were imagining.
Dr. Radhakrishnan, if I can bring you in here as a Tamil Nadu Health Secretary, sir. We saw in Tamil Nadu also the initial outbreak of cases came after when a large number of people who attended at the Tablighi congregation tested positive. Then it came down. Then again, it's risen again. What has been the big lesson or learning for you from this? And you've talked about testing using RT-PCR tests, but what also have you seen in terms of the mortality rate being low? What do you think are the big lessons here that Tamil Nadu must learn? Are there lessons perhaps from the Kerala model or from other states which you're looking at here to face the challenge?
See, one thing which I want to be very clear is that it's very difficult to compare states. For example, in Kerala, they were very, when people are not asked to go or quarantining, they were doing it religiously. Tamil Nadu, what we found was that, around 10 to 15% people were taking the disease casually. Because if you look at, people just go, many of them are getting cured. So we actually told them that perhaps you may recover as a asymptomatic person, but you will pass it on to elders. so are vulnerable. So our lesson learned has been that, now, of course, anybody who comes to hospital is getting tested. So even if it is not directly attributable to COVID, since he is a COVID, in case he turns COVID positive, all deaths get recorded as COVID positive. So having said that, we have also developed with our doctors, based on the general clinical guidelines which Government of India has shared through ICMR and all, locally what works best. Why somebody who was having some 65% lung adrenaline got cured, what kind of combinations of medicines they used, those kind of things we have done. But like our doctor just shared, the real success is in ensuring sustainability will be if for every activity where relaxation has been given, people follow the standard operating procedure.
Right.
And in general, the thumb rule wise, masks, social distancing, and hand washing, and ensuring that the elders and the vulnerable are cocooned. And needlessly, people should not go.
Right,
Our lesson has been that not compare even the districts, rural, urban. Just look at wherever these sprouts are coming and educate public that public fountains, public toilets, and
No, I think that bit is very important, that have different district models, different street models, different area, but have a SOP which stays the same wherever you are in India. And lockdown opening up doesn't mean that SOP gets relaxed. Thank you all very much. It was to have the experts on and such strong voices. It was wonderful to have you on NDTV tonight. Thank you for joining us.